everyone. Thank you so much for joining. So, as we all know, the future of patient experience will be shaped by a couple of combination of events. One is obviously an emerging technologies that we are very excited about, and we'll talk here. A high level of personalization when it comes to patient experience and the power that both consumers but also patients will start having with the data that they have access to, and also ultimately changes in the healthcare delivery models. So all these three forces together will shape the future of patient-centric experiences. But I think underlying element is really all about data, the usage of data, and utilization of these new technologies in the healthcare ecosystem. So I would like to actually start with that topic. I would like us to explore a little bit what the role will data play in future when it comes to patient-centric experience, and especially the interoperability of data, which we all know is causing a lot of disconnected experiences in a current environment. So maybe, Tim, I can start with you and chat a little bit more about the data itself and how we see that shaping the future.
No, thanks. And so it's been an interesting experience. The last 3 years I've been engaged at a nonprofit provider, IDN, Sentara, which also has a health plan component, but obviously for 135 years has been all about delivery of patient care. Previous 25 years was on the for-profit payer side of the world. And so interesting to think about the data we have on both of those sides and how they interconnect. If I think back 25 years ago, I mean, we were doing HIEs, creating data exchanges at the state level for Medicaid and for other places, and it was still stovepiped. And even today, I think you see a lot of that data stovepipe between payers and providers and even access to the patients themselves, right? If you even think about all the regulations that are trying to bring that together, give visibility to the patient and ownership of their own data, it's not happening consistently and it's not flowing. There's not a liquid flow of that data across the ecosystem. And as we talk about some of these things with AI, we talk about some wearables, we'll talk about other pieces that are part of that patient engagement. All of those are generating tons of data and fumes off of the systems that we're doing with claims processing as well as out of the EMRs. And if we can't unlock that data, have it flow across the environment, being connected, we're not going to have that foundation to apply some of the advanced analytics as well as the ability to do care delivery models that are different and can enable somebody to have that care at the place where they want it at the right time and have that be informed by the right insights. And so making that data flow, making sure that it's high quality and is verifiable, immutable, right? And some of the things we've been playing with, involved in an initiative around a blockchain consortium with folks like Elevance and others. Those things all are important to unlock that. So whatever we're doing at the surface, if at the bottom we can't have that data flow and interoperate across the system, we're going to be really hampered. So it's important to understand interconnectivity because you can get, I think, really excited about some of the bright and shiny objects at the top and what the folks are seeing, but it doesn't necessarily going to be impactful down to the level of creating better patient quality care, outcomes, and definitely an experience where today, I don't know about everybody else, but today what I see for my own family is data that is hard to bring together across from the insurance side to the patient care side and making sure that it's easy to navigate and not so abrasive. And so I think that's a good foundation to think about because it all has to tie into us being able to sort that problem out from the foundation.
Thank you.
Absolutely. I think, Tim, to just add to that, as we think about this from the Elevance Health perspective, we're privileged as the second largest payer to have access to tremendous amounts of data, claims data, social drivers of health data, other data. And sometimes the biggest challenge that we have is how do you bring that data to the right place for the right reason, in the right way for the right person, right? So why do we still have the healthcare experience today? I'm victim to this as well, of when I walk into my primary care doctor's office, I'm the one that's saying, hey, here's a lab that I did, or here's a test that I did, or here's something that I went to an emergency room for, I just wanted you to know about it. Why doesn't my doctor know about that before I know about that, right? If my primary care doc is supposed to be the quarterback in my care, and they're supposed to be the ones to proactively understand what's going on with someone like Milind and how do I help them? How do we give that person that data in a meaningful way so that they're not burdened by all this information that they're getting? But at that point in time of when Milind is sitting across from him or her, they actually have access to that information to have a meaningful conversation around Milind's care. I think that that's still an area where we have a lot to do, Tim, in getting better.
Absolutely.
I think, Tim, we if you think about the experience and data, a lot about this, I'm reminded of Mozart. And Mozart said many times ago, where in the world can you go and have 100 people talking and actually hear something beautiful, right? And that's in music. And I was at a honky-tonk place last night, and we're watching if a guitar player, you've got different people bring Android phones, iPhones, everything else. It's like a honky-tonk of data. But what we're finding is that, one way you probably integrated for years, Tim, is like you can do things like put it into Fire, build the pipelines. We talked about that. But now we've been playing with this thing where you take Google Search, and we're deploying that and saying, hey, can we do this stuff that deals with the honky-tonk of the web and use that to bring in and maybe play some music for the patients? And I think that's starting to take off a little bit. Yeah. And I think we're looking at Elevance, for example, can we bring that into the experience? And so now use all the tools we have. One is just do the pipeline cleaning we've been talking about the whole day, but also can you do stuff like from the web, where the unwashed web, you can bring that data together as well in an authoritative environment. I don't know if you guys would play with that at all, but that's something we're finding is a nice way to take a step forward and just take a lesson from Mozart.
I think it's a nice step, and if you think about it, right, a lot of people are looking for their clinical care and answers by Googling things and getting
just Google inside, right? Let your LLM
their
Google,
guys there.
right?
What I would say is that the problem with that, well, there's a couple interesting challenges. I know we'll get into deeper things, but some of that is around two key factors on the patient consumer side that I think we're challenged with, right? One is a patient that isn't ready to be the CEO of their own healthcare, right? And that means that you're taking accountability and responsibility about how to learn and understand that and navigate it, right? I'm navigating and doing more research and decisioning on Amazon purchases than I am on my own healthcare. So I think that's a key piece of it. Then the second piece of it, and this is a really important part from social determinants of health, right? If I think about, it was interesting, last year at a conference I was talking about SDOH, and you're thinking about transportation, we talked about food earlier, right? Some of it's about digital and data literacy. So some of it's about just health literacy that you don't have to be able to navigate and understand what's coming at you. And I think that's a problem. You can Google all this, but then how are you assimilating it into not only understanding the literacy or the simplification of what that means, but then how are you attaching it to the personalization, which has to come from that data about me specifically as an N of one to think about that data. And so those are exciting times for technology, but then figuring out how to make it digestible and actionable and getting them to engage in a simple way as a patient and, of course, as your whole family that you're trying to take care of. I think it's an interesting challenge, but it's also an exciting time to be dealing with all these tools in the tool bag.
Got it. Well, actually, if you think a little bit about it, all of us in the healthcare industry have a role to play in that. So we obviously, personally, someone that is working with patients and wearables, data that is being generated by either behavior or sensor data itself, is becoming a part of life of many patients. If you think about that, we have a role to play as a technology organization that delivers that. There is a role for the payers as well as providers. Ultimately, even if we are able to solve that foundational issue of data flow and interoperability. And then there is obviously a new technology that comes out. So I wanted to talk a little bit about what is your view in terms of the exact role that each of us should play from a payer perspective, from a patient engagement perspective, providers, and then that enablement of technology to actually make it happen. Because I also do feel that once when foundational issue is being solved with data, we still do have broken experiences from the industry ecosystem perspective. So I'd love to see your view on that.
Yeah, I think the biggest thing in that is that it's everybody's job to connect the dots, right? Yeah. I mean, sure, there's a fundamental of a business model that says, yes, provider, you're the front line, you provide the care. Payer, you're the vehicle that gives permissioning to that care. So you enable that and make it simpler to understand. Tech organizations, you bring that all together and enrich and personalize that. Yeah, you can live by those guardrails if you'd like to, But that doesn't build transformation in an industry like healthcare, right? And so I think the more we break away from those guardrails and say, no, it's going to take us all to do this together, forget the business we're in. What we're trying to solve for is all the same thing. We all want to live the healthiest, longest lives, and we want to be the ones to help do that for all of America and even for the world. I think then the role for all of us is then what access do we have to what information and how do we bring that together? Not necessarily this is my box or this is your box, right? But Tim, I don't know what you think.
Well, I've got a new perspective after 3 years at a provider-led nonprofit. So coming from, my last role was as a CIO at Elevance, so everybody doesn't know that. So it is interesting for me to think about it because a lot of that was when I was trying to drive provider collaboration from the payer side and understanding why they weren't all collaborating with us. It's about, has to be some compromise and concession. It can't be one side has to win slightly over the other. It has to be for the greater good. And I think we all, in our own places, have the mission for that greater good. But, other things, financial, stockholder, other things drive you to not necessarily have that in a broad, compromising way where you're giving up on either side. And so for me, it's interesting, the perspective I have today, our system is about, Sentara Health is about $13 billion. Slightly half of that revenue, more than half of that revenue is in our health insurance business, believe it or not. So we are a health plan as well. And then half of it's on the care delivery side. And our largest payer that drives our revenue on the healthcare care delivery side happens to be Elevance. And so it's an interesting view. Obviously, I have lots of friends and colleagues still over at Elevance, and we are teaming to do lots of things with Epic Payer platform, connecting, interchanging data, things that are allowing us to have win-win in that environment. But even when I'm trying to integrate the overlap of when I have a health insurance member and a patient that are both getting both sides, I should have a beautiful experience and allowed to gauge across that. And I can tell you we don't. And that's even within our four walls. But we're changing that. Our new strategy we just announced in the 3-year transformation we're doing around called One Sentara. I had a One Anthem when I was at Anthem actually, but anyway, so it's not particularly a unique name. But the concept is if I own both sides of that house, how can I not feel that I've got to provide that good experience? What can I apply to that? And in that place, you have a little bit of right pocket, left pocket, where you can have that compromise. In my opinion, across the industry, we have to figure out how to do that outside the industry as well, and that's tougher when you have different pressures as a community-based, not-for-profit hospital system, and you're a large payer with shareholders and other things, other pressures as well on a quarterly basis. But it does mean setting down some of that aside and looking for the greater good for the outcome of the patient and members, which we all want, because we're all a patient and member too, and we all want something that's affordable and that could be sustainable, and we're not there where we are right now.
Yeah, I think that if you think of the hyperscaler role, in our role in our working with Elevance and you guys, it's that we're trying to make it as easy as search, in the sense that how do you make this easy to understand, easy to use, easy to deploy, but at the same time it's rock solid secure, right? And we can also start to talk about how do we actually put these new technologies together, like the Gen AI I talked about today, how we do that in an ethical way, and what are the right rules so we can sort of progress this in the experience. But I think that's what we're holding ourselves up to, is how do we make this the point where these sophisticated technologies go by the wayside, and you're now thinking about what's the outcome for the patient, how do we make this really easy to understand and easy to use so you don't have to explain it to them, right? And I think that's sort of the true north we're trying to get to. And I think I'm encouraged by some steps that we're taking, like Google and others, to actually make that happen. And we're seeing some things where, we talked about the search a little earlier. I was giddy when I saw a customer take that and within a week have something operational, right? And it's like you put a Fitbit on, it just sort of works, right? And I think that's the kind of experience I love to have for myself when I go, for my own medical care. But I think we all sort of would like to get there. And now we're starting to see technologies that are really encouraging just this year, that can really start to change that, and it's an exciting time.
I think the other interesting thing around that, bridging to, I think, 2 panels ago, there was a conversation on partnerships, right? So I think some things we're looking at there, and Google's been a great partner as well, and another great partner for us has been Epic, and really thinking about maybe how does Epic help us bridge that gap, right? So they're not a provider, they're not a payer, they're kind of sitting in between that, and they have that delivery mechanism for a tremendous amount of the providers. While not every provider uses that as a system, how do we maybe templatize with that and then go to other kind of partners like them and maybe allow them to be that central source of that information, right? So I think there's ways we can be kind of innovative around that.
So getting that integrator spot is going to be a big part of solving, obviously, for the ecosystem. I like that. We touched a little bit about the technologies. We touched a little bit about AI, and I would like to bring us into that domain as well. So obviously AI is touching the lives of all of us, and it's entering big time in healthcare. We all know that. The question that I have is more about how we do see that technology shaping not only user experience, but also transformation of the entire approach to health. So instead of going and treating sickness, how do we go from that sick care to a healthcare and to actually caring about the patient? So Scott, we have announced a lot of stuff with Google recently, and we also see Vertex integration with AI powered by some really powerful tools that can solve those very early stages of problems that we see in healthcare. Would you like to talk more about what would be the AI and the tool sets of other technologies and what roles they will play for the entire experience?
Yeah, I think a couple things. We've done biostats for a long time. If people know the correlations, and that's been done with standard things like blood analytes and just doing blood tests. And now with new technology that's just come on in the last few years, even this year, you can now start to look at correlations across data sets you couldn't even imagine before. Taking a correlation between not just the blood measurements and whatnot, but actually look at images, right? Look at the environment in which their speech pattern, their cough pattern. Look at now things at a nanoscale level, which was just basically unaffordable. If you look at the heads of oncology in a lot of these hospitals, brilliant people, but when they went to school, it was $1 billion to read your DNA. It's going to be $100, right? And that's like, for example, when you have a newborn, it's about $170 in California to basically get a neonatal test to figure out these missing things. You'll be able to get a digital version of that and whole genome very inexpensively. And I think these are really promising technologies you can now bring in. So now we can start, if we can rack and stack these measurements from all these different types of data, we call them modality. That's what makes up multimodal models. We can now find patterns where, with technology, you can detect sickness before you feel it. You can detect sickness before you see it. And if you can then, from that, just work with Leroy Hood and others, once you can figure that, if you look at histories of a longitudinal patient record, which HCA is doing, you guys are doing, look at that, you can now say, why don't you adjust what you eat just a little bit, right? And eat a little more vitamin C, eat a little more vitamin D, or change your habits to actually steer your gut biome. Yeah. And so these are really phenomenal things that are happening in the labs today that I'm really encouraged by, that now is going to be true like data-driven health, where you're going to go in, you're going to have, you pull out your phone, we're our own CIOs today with your images and video, your health data will be here, right? And you can now bring that into bear, and I think maybe by 2030, we'll be aghast that we used to go to the doctor and not have that data. Because we're flying, in a sense, because the machines can now see these patterns that we couldn't detect with MRIs and other things today, but you can see it at nanoscale level. And once we can see that, we'll be able to, we'll start to see that shift from actually, once you feel sick, maybe it's too late, but can we detect it earlier and then make cancer a manageable condition? I mean, Leroy Hood, I don't know what you think about this, but he thinks a lot of the chronic conditions will essentially disappear, and because we can now manage this and then live a much longer life. So I'm excited about that. It's very new, very early, but I tell you that the generative AI you saw this year, the stuff you see in next generation sequencing, CRISPR, it's been a really exciting decade, and it's now changing exponentially fast. 100 papers a day.
Got it. Yeah.
I think you're touching on, we're touching on a couple interesting things, right? Is the fact, and we think about that for the goodness and we'll say the affordability of our environment, right? Because we talked about back years ago, even when I was at Anthem, around paying to have genome data, testing done and sequencing across all of our membership to do some of that. Yeah. Then you're stuck by, well, they may not be a member next year, right? Or
what, right. How do you get paid for it?
So part of this is thinking, what is the broader holistic view of this? Some of that means us working together. Some of it means it getting to the cost point, which is, like you said, a big piece of it. Back then, I think it was probably around 500.
500?
I think it was down. I think you thought you could do it around 500, or it was getting close to that level. But if you think about applying that, then you're talking about doing all sorts of insights around predictive models and understanding what that may be for their health and how they can change it on a precision medicine personalized approach, right? So I think that's really exciting. But when I think about when your question around enablement of some of the current tools, with some of the things I'm seeing, and it's an amazing shift, which I will give credit to the press and social media around Gen AI. Obviously all you need was the press of Gen AI and talking about how this is going to kill the person's college education and their kids won't learn anymore, and get that blown out, to actually get the CEO and non-technology executives in the company to say, what are we doing with this? What are we doing with AI? Why aren't we doing a lot with AI? I was like, what are you talking about? I've been talking about AI and machine learning for 20 years. You didn't want to do it. I mean, so the question is that thing has generated a whole discussion where they're like, immediately, I will tell you, we went from, months ago, the CEO of the board, me presenting to them, it's explaining the different types of AI and machine learning and predictive models and what's Gen AI and how you use it in use cases to, 3 weeks ago, we set up our first ChatGPT 4.0 private instance inside of our 4 walls.
That's awesome.
We went live 2 weeks ago with our first LLM pilot in our acute spaces for hospitalists, generating discharge summaries off of the data within there, right? 18 months ago, we applied ambient listening into our ambulatory space for primary care. So those are things that all generate tons of data that we want to be interoperable and connected,
right,
and be able to trust the security of them connected to the unique identity, right? But if you think about that, and that shift is one thing. The other shift I've seen in the recent years has been a shift where physicians have gotten, and clinicians in general, have gotten on board with assistive technologies. Before, they were like, I don't need this stuff. I'm the smartest person here. I don't need somebody to tell me what this is supposed to be. I don't trust them. To now them understanding this assistive technology is helping with burnout, all sorts of other things, right? Because what we're doing with ambient is reducing by 2 hours a day their note-taking, the note documentation they're doing in the evenings, right? What we're doing with the LLM inside of the hospital with hospitalists are getting through, is helping reduce burnout as well. It's also helping with proper billing to the payers as well. But it's doing those things, and so that's what I think is exciting when you think about some of those things being applied. It also makes me step back and wonder about, is the patient ready for what we're coming with? And I think that's a lot more of the conversation we're going to have to continue to have.
I think, and that's an interesting point, right? Is I think a lot of where we're seeing this opportunity of applying this technology is in helping the patient, but through the associate or the provider. And the reason for that is exactly what you're saying. One, I don't know if the patient's ready to just trust this technology. Two, I don't know if the technology is ready, quite frankly, to give that right answer and the responsibility of what we have to our communities and our providers and our members in that integrity and trust, right? Of that accuracy of what you're giving, because this is not a, I ordered Pampers and I got Huggies instead type of thing, right? This is, I've put a person down maybe the wrong care path, right? That could lead to a lot of other things to worry about. But I think the other thing that's interesting about this, it's funny we started with the conversation on data. We spent a ton of time at Elevance focusing on what are the right things to bring together to do something as simple as like calculating what we call a health score, right? It's the one thing that at the end of the day, if Milind wants to look at how healthy am I, what are all the components of that? Now what we can start doing with these advanced models and Gen AI and all these great things that are coming out, right, is with that, for a provider or even eventually for a member, start doing interesting things like if Milind is a diabetic and somebody that has cholesterol issues and the last 3 generations of his family history have died of a heart attack, well, the first 5 days that Milind doesn't take his cholesterol medication, what's that trending? A year from now, 2 years from now? How do we bring that back to Milind? You need to take your medication tomorrow because here's that trend and figure those things out, right? I think we're getting more advanced and interested in how we can do those kind of things.
I think it's a very interesting point because the contextual element and the data availability provides now a whole new level of context, not only measure data, but also behavioral data, even self-reported data, like how, when you wake up, I can tell you, first thing that people see is obviously their sleep scores and how they slept and how they feel. They try to also correlate their stress during the day with the activities that they've done. And then if you add on top of it, let's say, condition management, so now suddenly you have maybe an underlying condition that is being monitored over time. I think the access to this context to the doctors will be extremely powerful to any clinicians. And in the end, they will be the one making the decisions, and hopefully with these new technologies that Scott was mentioning, those decisions can be complemented by these powerful new tools. And I think we've seen that a little bit more with patients. So not really giving a control over someone else, but basically understanding the context of their behavior and the data that they see and making that available to the doctors. I think it's a very powerful trend that we obviously see. My question was a little bit also about the prevention. So the power of models can also go in terms of understanding better risks, understanding a profile, and also seeing if certain data that patients are generating can potentially give us more view on early detection of the diseases, as Scott was mentioning, but also just the risk profile of even getting to a moment of developing something. So I wanted to get your perspective on technology when it comes to risk assessment and understanding of potential issues that might happen for a specific individual, and how do you see those models potentially playing the role in your businesses?
No, Tim, you want to go first?
Go ahead.
No, please.
So there's two different views of that, right? So when I think about risk modeling in the past 30 years, what I've been focused on is really about the actuarials around how to price and offset the risk of cost of care, right? So, which is really important, and we've invested a lot on the payer side to make that effective because it's really important to that business to be able, financially viable. Taking that, adding clinical data to it, genomic data to it, these other things is pretty exciting, right? Because you're benefiting both in terms of risk and prevention of that risk. And if you could take those actuarials and have them be more aggressive with understanding what that risk may be and their ability to say, hey, I can prevent that risk, and changing that price point from a premium standpoint, you can talk about impacting affordability. And that's really an important, important issue today because it's, affordability is just maybe second behind access as probably the two largest problems, right? I know we haven't talked about access yet, and maybe we won't have time, but access and how to use these technologies to increase that access, which also gives you more data that you can then act on from a risk or a preventive standpoint, is really important. But we continue to see that as an important predictor, be able to drive care, care gaps, outreach in terms of care management, disease management. I think those will continue to be important. And the more that also you can take that data predictively and then bring that into the home and wherever they happen to be, and be able to drive more of that home care. And then we can get into telehealth, e-visit, things like that will help with other touch points. I think it's really important. And then you got to take that risk that most people can't understand when you're trying to say it, not say it in layman terms, and how do you present that to the patient or member so they can be the CEO over their own health and understand it in a way that allows them to say, oh, maybe I will change this behavior or that behavior because now I have greater information about it. It won't necessarily change everything, right? I know I shouldn't eat, Krispy Kreme donuts. I still do.
Yep. They taste good, though.
It may not change it, but at least I know the risk and the accountability for what it might do from my cost standpoint.
Hey, Tim, you said something about affordability and ease of use. I think what I'm finding, which is I find counterintuitive, especially for AI, because I grew up in AI. We've always wanted to build the AI doctor back in mice in the 60s. And I talked to a GI recently. She goes, well, I don't want that. I said, what do you mean? It's fantastic. And you can like, she goes, I don't need that. I said, well, what do you need it for then? She goes, I need it for pajama time. And then she's walking me through this, and in the sense that she goes, if you can just get the data for me together, the modalities of data, let me do it at home, right? So that after I have dinner, I can sit down, I'm going to look for 30 charts, pull the data together, make it accessible, make it affordable, and let me crank through my documents. That was one. Talked to a head of oncology at another department, and he's like, here's what I need help with. I don't need a diagnostic side. It's a neat idea. I said, well, what do you need? And he goes, I want to watch the game. And he said, well, what do you mean? He said, well, same thing. After dinner, he's got to chart 70 patients. And he said he was trying some early technology, like your internal LLM. He did it in 15 minutes. He goes, not only that, it was a better quality chart than I could write myself. And he said, I prompt it with a little bit of the notes I write myself, but it complements it and fills it out for me. Yeah. So it doesn't generate the answer, but it has to reason about the modalities. It's got to be affordable. It's got to be fast. Got to work remotely. Yeah. And then when I went to his annual event, he asked the room, what's the most powerful technology that you've seen in the last decade. I'm thinking, oh, it's got to be next generation sequencing, right? Or it's got to be some, maybe new immunotherapy. Throughout the room, Zoom was number one.
Yeah.
And I was like, wow, that's interesting. And talking to them afterwards, it's like what you talked about. It's affordable, it's accessible, and I can immediately talk to my patients when she can't get there because she's not feeling well.
Yeah.
And it's bringing the patient and the doctor better together. And I think that's how we're going to get the diagnosis in there. So we're going to go after pajama time, the burnout time, and get that burden off the doctor.
Yeah.
And that's going to get the adoption of the models. It's going to get the price to come down, and then we can think about diagnosis.
Yeah. Well, and hopefully accessibility, because you'll have
accessibility, right?
That's historically a huge problem. I mean, I was obviously not excited about COVID, but excited about where telehealth went during.
And the
COVID.
Regulators kicked in too. They let us do it across state lines too, right?
And now they're pulling back. They're pulling back certain things that are bringing it down, and we're seeing it way down, and now it's still depressing. I mean, it is the only way. With burnout and clinician shortages.
And the nursing too, it's another one.
To get the access back up, right? Because I have nurses leaving the hospitals for jobs elsewhere.
As travel nurses, right? Do the same job.
Or they're leaving it to just work at home and do virtual nursing and other types of things that they don't have to be bedside. And so we've got to get virtual care improved and backed up in the right, on both sides. Both, there's a lot of clinicians I'm speaking to that are happy not to be doing it again. Not all of them. It depends, generational in some cases. And then you got patients that are falling back into, no, I really want to go in person. So we've got to figure out how to incentivize and engage folks where that is the right answer to meet. Because I think it's the only way you can both get affordability, definitely access. Access is just a massive problem, right? Every time, how many stories did I keep from my own family talking about the next appointment's 9 months out, or recently with my wife, a month out on a diagnostic that had tremendous anxiety. That luckily I worked for a health system that I got her in 2 days, but that's not
normal, right?
It's not normal. It's not what it should be for the rest of the country.
I'm sure, and you're seeing this too on virtual. It's unlike when the pandemic was at a peak, it's not virtual first, virtual only, but there's a place for it that I think we're all still trying to figure out as an industry what it is. We all talk about hybrid care, right? Physical and virtual together, but I don't think we've figured out when is the right place to have virtual, when is the right place to have physical. How do you bring those together in a way where you could truly capitalize on all those things you're talking about, right? Reduce burnout, improve access, make affordability, kind of a lever we can pull and do all the things around it. But I think also, Scott, to what you were saying earlier, reminded me, I think one of the things we've also learned is sometimes the simplest solution is actually the best solution, right? So one of the things that we learned very quickly was sometimes it's as easy as just SMSing a member and saying, hey, you're due for your annual wellness visit. And you'd be amazed at the turnaround you get from that. From just something as simple as a text message.
That's great.
Yet sometimes as an industry, we try to complicate this, right? And we want to build some app. And we want to build some fancy thing with some models and stuff around it. But maybe all it is some AI in the back end to say, Milind is a trigger point if he doesn't go for his wellness visit for these reasons. Just nudge him, right? And that could lead to some. Yeah,
I think that's so smart. Is that a lot of times we say let's apply a transformer for that, right? Like no, if then else is good enough, right? Yeah. And I think, but also what I'm hearing also in the panel here is that going after the business of healthcare. In other words, how do you enable patients to spend more time with their doctors? And I think it's all the, on the provider side, how do you generate the paperwork? And on the payer side, how do you receive the paperwork? With these tools, we can actually improve the quality of the paperwork, improve the velocity of it, and improve the traffic light on either side. And I think that's what that volume will actually take a few $100 billion of cost out. Yeah. We can figure out, does that go to profit? Does that go to the growth? What happens with that? And then that's going to then get the cost down of these models to then go after the money that we see, which is the notion of like changing from sick care to health care as an industry. Yeah.
Well, and we're kicking off with Elevance right now, an EPA, through our Epic payer platform connection that we're going to be doing real-time authorizations.
On both sides, right?
On both sides, yeah.
So you generate it and then
so we generate all this stuff, not back and forth with denials or appeals or where's this documentation, they can get all of it. So I mean, that's talking about administration cost and time from clinicians that you can repurpose, right? And I think what you said in terms of SMS messaging, just one piece of that. I know somebody earlier was talking about journey mapping, and journey mapping is a big piece of what we're doing in this one Sentara strategy. And the problem is, right, we are fatiguing the patient member, even on both sides, around messaging and stuff. So yes, it can be as simple as that, but you can also kill it all by not doing it in the right way. And so figuring out that, what is the right journey map? What is the right, and that goes back to personalization and segmentation and how do you want to interact with folks. It was interesting, I was having this conversation about the fact that we have, epic messages, 1.9 million messages, and the physicians can't get to all of them, and they're just messaging away, and you probably heard that certain health systems like Cleveland Clinic, other, are charging for messages. We're not, so they're just out of control. And so the question is, I said, well, listen, and you're saying the message usually isn't in the right structure, what you need to do or even need to see. I said, let's make it as hard as possible for them to find the message button, okay? And through that guidance, you're helping guide somebody to hopefully the right place where they are. And if they eventually have to send a message, that's fine. But how do you help them help us by guiding them into the right place? And that can be through digital nudging. It can be for how you have the interaction in the physical space or even on the digital app or portal space.
Yeah. And the prior auth is a great example of something that I think we can extrapolate and do better as an industry, right? I mean, how much do we have, for the right reasons, obviously, in the checks and balances of a process we've put in place, that ultimately on the other end, the member's just there sitting, waiting, weeks, sometimes months, to just get care.
For us to battle out.
Right, for us to battle out.
Who's gonna
something
pay
as
for
simple as
nothing?
like,
Yeah.
you didn't give me the right image, or you're missing this test, or you didn't give me the right code, right? And it's these fundamentals that I think we can do differently, and that partnership's a great example of it.
Yep.
Looking at the time, we are at the very end, but I think it's still good to get your maybe final reflection on one thing. I think clearly the patient engagement and empowerment also of patient and stimulating that new way of thinking will be a big angle in solving this complex point. I wanted to get maybe your last view on the health continuum journey. If you think about going from population that are in healthy living state, they're just doing prevention, early diagnostics, and ultimately managing maybe a chronic conditions or acute care events. They will all be engaging with new technologies and the ecosystem with partners in a different way. Some of them are very invested because of the awareness and the challenges that they're solving. Some of them are remotely aware of even issues that might come. And some of them are just the passive observers of what is happening around them. I wanted to understand, how do you think our engagement with patients across that continuum will vary when it comes to different type of technology and different type of modules that you could leverage as an organization to actually impact them? Because we believe that level of personalization can solve a lot of challenges, but it will have a slightly different approach when it comes to health plan, clinician engagement, and so on. So wanted to understand your perspective of that continuum and maybe technology that can play a different role for each of these segments.
Yeah. Scott?
Well, I think we're a minute over, but I think a couple things. I think sitting is the new smoking.
Yeah.
It really
I get
is.
a nudge, I got
Right?
three
I mean,
today.
it's like we used to smoke on planes, and that's unconscionable today.
Yeah.
And we do these things to ourselves. I saw this young woman. She's on TikTok. If you got to see this. She's talking about, my God, this new 9-to-5 job. I got to commute in. She's crying, and it's like, right? Why do we do this to ourselves? And now we have a technology that can do the sitting for us. And so think of all the things like the doctor who wants to watch the game because with his son in the evening. We can give him the technology you're building to let him do that, right? Attending a meeting, we're all talking about that now, where the AI can actually go and observe for you and give you a summary, right? And so I think if we look at in the business of healthcare, where are we sitting? Just don't do that, right? And then and you're standing up, you're talking to your patient, you're doing something, you're not at a keyboard, not something else, and just get rid of sitting. And I think we're all going to live healthier lives. We're going to build much stronger relationships between the doctors and the patients, and also much stronger relationships at work. Because now you're not sitting around, you're actually working with people.
Correct.
So that's where I see it going.
Thank you.
Yeah. And I kind of see two core prongs that we've got to attack in both ways. We have to be able to walk and chew gum at the same time, right? I think one of them is these foundational things we've been talking about, right? So we, especially in our industry, we have a responsibility to make it a simpler, easier environment to navigate, just administratively, to get appointments, to get in and see doctors, to pay our bills, to do those things, and to make less administrative cost churn that's happening between payers and providers. So as a foundational, we need to free up more availability of resources, clinicians, financially in that prong. At the same time, we have to figure out how we're going to reimagine care delivery. And I don't even want to call it care delivery, because I'd rather call reimagine health and wellness, right? Because I think we have to be thinking out far enough about where that's going to get to and how we're going to change those things. It will enable better care delivery as well. And so we've got to figure out how to do both those things. That's difficult. I know a lot of the technologists in the room or CIOs in the room are the things that you're being asked to mainly do to save money and cut costs, which isn't necessarily solving the foundational problem that I'm relating to. At least you're doing it only in a silo. The second piece of it, and try to be inventive and find out what Gen AI means at the same time. We've got to be able to do both those things strongly and with partnership from technology companies, from other partners in the industry to help with both those things. So I think we have to figure out how to do both those things, and they will lead to better patient experience and patient engagement if you also make it easier to do this while at the same time figuring out how to get providers to have a different care delivery and or health and wellness process across the full spectrum of wearables to surgeries, right? I mean, I think we've got to figure out how to do that. And it's on us if we don't.
Yeah, absolutely, Tim. And firstly, before I respond, thank you to Emids for having this forum, and thank you to everybody in this room. I always say healthcare is a team sport. It's not just the payer, the provider, the tech company. It takes all of us to solve for this, right? And so I think this continued transformation is just something we all have to be in together. And it's an honor and a privilege to be a part of that. I think, simply put, healthcare right now, it's a job, it's work, right? For the sickest person, it's a full-time job. For the healthy person, it's still a task and it's work, right? So I'd love to see the day where healthcare isn't work and it's not a task and it's not a job. We should just be living. There should be a natural flow. You take concepts like a job to be done framework, et cetera. Humans don't need to think about this unless it's something that's disrupting them. Why is it something that I have to be bothered by? That's what I'd love to see us change as an industry, and if we can do that, I think we've done all these things that both Scott and Tim are saying, and probably even more.
Thank you. And I think that vision is something that we should all be obviously following. And we just scratched the surface today with a couple of big topics that are preventing us to have that seamless experience and redesign the future. So I really appreciate your time here. And thank you for inspirational talks and some food for thought. And I know that we are between drinks. So I want to thank you very much for being with us here. And we are around for any questions later on if you want to chat. Thank you.